Thank you, Mr. Speaker. The impact of poor mental health on our citizens can't be overstated, and we need to adequately address mental health issues in this province for economic reasons, public health reasons, and simply because it's the right thing to do. We're coming up on a year since the Valuing Mental Health Next Steps report was released, and it has been 2 years since the Mental Health Review Committee's report. To the Deputy Premier, how many of the 32 recommendations and 18 actions proposed by those two reports have been addressed?
The Honourable Deputy Premier.
Thank you very much, Mr. Speaker, and to the member for the question. To date, for the 2017-18 fiscal year, we've granted $35.8 million directly to AHS or community organizations to implement the recommendations of valuing mental health. And earlier interventions, of course, were in children and youth, better access to mental health services and supports for those using substance use, new detox beds, and so forth. Mr. Speaker, I'll be happy to table the exact number, but we are well on track. We've implemented a great deal, and there is still more to come, Mr. Speaker.
First supplemental.
Thank you, Mr. Speaker. Given that the habits and practices that lead to good mental health are best taught in early life, and given that young people and adolescents are especially vulnerable to mental health issues, and given that it can be harder for young people to access mental health supports in the same way that adults do, to the same minister, what is being done to ensure that young Albertans specifically are able to access the necessary mental health supports and services?
The Honourable Minister of Health.
Thank you, Mr. Speaker. We're making smart investments that support our children and youth. For example, we funded new counselling supports for survivors of sexual and physical abuse, including the Zebra Child Protection Centre. In 2017, they supported over 1,600 children and youth. We opened a new Rutherford mental health clinic here in Edmonton for youth in Edmonton and the surrounding areas, which triples capacity for this region. We're building a new 8-bed youth facility in Red Deer. We've added new detox beds for children and youth in Calgary, which result in shorter wait times, Mr. Speaker, and the list goes on. The need does as well, and that's why we won't let up. That's why we won't allow for the deep cuts that are being proposed by the members opposite.
Thank you, Honourable Minister. Second supplemental.
Given that the demand for mental health services and supports are only increasing, and given that the people suffering from mental illness or trauma are often desperate for any offer of help at all, and given that this desperation can often make them targets for unlicensed and unregulated counselling and mental health supports, a practice that could lead to even more long-term harm, to the same minister, will you assure this House that you will regulate mental health counsellors and mental health services so that Albertans know that they are receiving a high standard of care when they seek it?
The Honourable Minister.
Thank you very much, Mr. Speaker, and to the member for the question. This is something that we've heard calls for. It's something that we are in the process of doing consultation on, Mr. Speaker. We want to make sure that we get this right. There are a variety of different types of people who use the term counsellor, whether it's a guidance counsellor in a school, a financial counsellor, or emotional, psychological, social support, or religious counsellor as well. So we want to make sure that we do the right consultation with the community to get the right feedback and make the right decisions as we move forward, Mr. Speaker. But I appreciate the vein of which the question is being asked.